back to At the Heart of Birth. In the first video, I left you with the notion of compassion in birth. We also spoke about the importance of selecting your birth team and how that played a role in optimizing your birth experience for you. The overwhelmingly positive feedback to the first video is confirmation to me that there are many women out there who want to love their birth and want to work towards a positive, optimized birth instead of just a perfect birth. Thank you for leaving your comments and thank you for sharing more about yourselves with me. In my work as birth professional, I often see women who are overwhelmed, confused, ill-informed and even disrespected when it comes to their choices in birth. Not only are women not truly empowered with knowledge when it comes to their births, but they are actually often rejected and judged for their choices, which to me is even worse. There seems to be a lot of focus on just the clinical side of birth, which is important, but the emotional side and the emotional journey is being neglected. Renelle, mother of two, and one of my birth clients will tell you how it is the little gestures in birth that is important and how crucial it is to feel respected in birth. The goal of this series is simple. I want you to love your birth experience. I want you to have an optimized, positive birth experience for you and your baby and your birth partner. No stigmas, no pressure, no judgment, and no bashing of choices. Just a lot of unbiased, empowering information delivered with compassion in the comfort of your own home. Are you ready to be clear and confident in your birth choices? Are you ready to work towards a positive and optimized birth experience for you and your baby? Are you ready to love your birth experience? Let's get going. Before we dig in, let me just remind you of the 4 truths that I highlighted in my first video that is absolutely crucial to remember when preparing for your birth. The first is your birth team matters, and we spoke about that in the first video. The second is compassion in birth is not just a nice to have, it is a must have in birth. It is almost, if not as important as your clinical well-being in birth. Thirdly, knowledge is power, and that is what we're going to talk more about today. Lastly, there is no such thing as a perfect birth, and we will get to that. Natural or C-section, epidural or no epidural, breastfeeding or bottle feeding. These are just some of the many questions that I've heard in the more than 50 births I've attended as birth photographer and mentor. There is no right or wrong answer in my opinion, and in today's video I will share with you how clarity creates confidence and how knowledge helps you to make empowered choices. I'm also very briefly going to explain to you what all the aspects of birth are before, during and after birth, so that you will know what sort of questions to ask and also where to look in terms of what is important for you in your birth journey. You do not know what you do not know. This rang very true for me as I was breathing through my induced surges with the birth of my first child. And what followed that was an emergency C-section, and with my second pregnancy, a VBAC journey. So I didn't know what to ask, and therefore I didn't ask the right questions. I'm going to show you the importance of being confident and clear in your choices and outline all the options for you so that you will know what to ask and have a plan A, B and even C ready. Stacey Leemanuk, one of my birth clients and the mother of a beautiful baby born at 32 weeks, will tell you more about how being clear and confident about your birth is important and how important having a plan A, B and even C can be.
So it is important to have a birth plan to advocate for the birthing experience that you want. It is also important to prepare alternatives to your primary birth plan and to discuss non-negotiables with your doctor. In my experience, I prepared a primary birth plan and discussed alternatives and non-negotiables with my doctor before my birth. But when I gave birth due to an emergency C-section, my doctor honoured all the non-negotiables of my birth plan, which helped me have the birth experience that I can be proud of.
To get you started, I've developed a comprehensive birth plan or birth preference outline for you, which you can download now. Stop this video, click on the PDF below and download it, and once you're ready we can continue. I would really like to encourage you to work through this birth preference or birth plan with your partner so that you can decide which aspects of the birth is important to you and make choices and decisions in terms of those aspects. It is also very important that you then communicate your birth preferences with your primary birth team as previously discussed. Before we start on the different aspects of birth, it is important that we discuss just briefly again the two barometers that will actually have an impact on the choices you make. The emotional aspects of birth and of course the very important clinical aspects of birth. I would be the first to say to all my clients that how you become a parent is not nearly as important as the fact that you do. That being said, as the survivor of severe postnatal depression, it would be irresponsible for me to say that the emotional journey of birth is not important. I am also the first to say that how you experience birth before, during and after can have a huge impact on you as a person for the rest of your life as a parent. Your birth choices should therefore be discussed and considered and made with consideration to both your physical and your emotional well-being when it comes to birth. This video is not nearly long enough for me to discuss every aspect of birth in depth, but that does not mean that they do not need your attention. I will briefly outline the different aspects of birth and discuss one of the aspects in depth. The rest of the aspects will be discussed at a later stage. So the things to consider before birth, in other words, when you're pregnant, the choices to be made. There's obviously, you can go as far back as to say the decisions are made even before you fall pregnant. Some couples struggle with infertility. So there are certain fertility choices that you have to make when you are planning a pregnancy. There are also other choices to be made in terms of falling pregnant. Some people suffer from certain illnesses like diabetes. Some people suffer from depression. Depression during pregnancy is something that is really important to consider and make important choices about when you fall pregnant. Let's talk about the aspects of birth itself. First of all, the very important birth team. There is the selection of your birth team and making certain choices about your birth team. I will explain this one in a bit more depth just now. Secondly, you have to make choices in terms of your birth environment. Where do you want to give birth? You might want to give birth at a hospital. You might want to give birth at home. And whatever you decide, you need to make sure that the location of your choice can offer the things that you require. For instance, if you want a water birth at a hospital, you need to make sure that that hospital provides you with water birth. There's also certain things like atmosphere, ambiance, things that's important during, for instance, natural birth. You need to consider the lighting aspects. Did you know that harsh lights can actually prohibit birth, natural birth? And also, things like, do you want to listen to music? Do you want to listen to birth affirmations? There are really important considerations to be made in terms of your birth environment. Thirdly, the very important pain management. I think this is probably the one where most people actually ask the most questions about. So you have certain choices to make in terms of managing your contractions, the pain that comes with it, or the surges. Do you want to employ hypnobirthing techniques to manage the pain? Do you want an epidural? Do you want to be offered other options? Internox gas. There are so many options in terms of pain management, and it's not discussed in depth nearly enough. So you can't really make informed choices if you don't know what all the options in pain management are. If you give birth naturally, there's decisions to be made in the second stage of labor. so that's the final stage, almost just before delivery, there are certain decisions that you need to make and discuss in advance with your primary healthcare provider. There are simple choices to be made in terms of the actual delivery of the baby as well, whether in natural birth or in a C-section situation. For instance, delayed cord clamping. I don't know if you know what that is, but I'll briefly explain. It is to wait for the blood to stop pulsating in the umbilical cord before the doctor clamps it or the midwife clamps it and cuts it. So, and there are many health benefits to that. So delayed cord clamping isn't something that you want, and you can ask for it and you can discuss that with your primary healthcare provider. There are also immediate decisions in terms of skin to skin and breastfeeding. So that are the decisions in terms of actual delivery as well. There's also choices to be made immediately after your baby has been born. They call it the golden hour period, and this is really the crucial time for mom and baby to bond. There are choices to be made in terms of that first hour. It's a really important hour in the baby's life. So again, skin to skin might be something that is really important to you, and we're talking about the ideal birth situation, but you also need to think about in a situation where skin to skin might not be possible because baby was born prematurely or there was complications. What would be a secondary golden hour solution for you in that situation? Think about it at least. In a hospital situation, there's also the question of visitors. Do you want visitors there in the first hour of your baby's birth, or do you actually want to wait until you've had time to bond with your baby? These are things that you have to think about and discuss beforehand, because once you're in this situation, you can't really make choices then. There are also certain choices to be made in terms of your baby, the care of your baby. So for instance, do you want them to use pacifiers with your baby or not? Do you want your baby to be bathed? There are so many choices in terms of the care of your baby. Vaccinations, circumcision. There are lots of decisions in terms of the immediate care of your baby as well, especially when in hospital. There's also further postnatal choices to be made on breastfeeding, taking care of yourself, but I'm not going to go into too much depth now. As said, I can't really go into too much depth right now in terms of each and every aspect of birth because there are so many, and I don't want you to feel overwhelmed. But I'm briefly going to just talk to you about selecting your birth team and the role players in your birth team. So first role player is your primary healthcare provider, as explained in the first video. Your primary healthcare provider can be a gynecologist, an OBG, or it can be a private midwife. I'm just going to explain to you the different situations in terms of when you would employ who and how it would work. In a private hospital situation, you have the option of having a gynecologist as your primary healthcare provider. Some hospitals also give you the option of having a private midwife as your primary healthcare provider with a gynecologist as backup. If you have a gynecologist as your private healthcare provider in a private hospital situation, you will have a hospital appointed midwife as your secondary healthcare provider if you give birth naturally. You can also ask to have a private midwife as your secondary healthcare provider in some hospitals, with the gynecologist still being your primary healthcare provider in that situation. So instead of having a hospital appointed midwife, you still have a private midwife for support, but it's overseen by a gynecologist. You can also have a private midwife who leads your birth in a hospital, in a private hospital, with gynecologist backup. There's also certain clinics and hospitals, especially state hospitals, where you will have a hospital appointed midwife as your primary healthcare provider with the backup of a gynecologist if need be. If you have a home birth and you do have medical aid, you will probably have a private midwife as your primary healthcare provider with a gynecologist as your backup. That backup needs to be prearranged and agreed to with the gynecologist. If you don't have medical aid, you can still have a private midwife at your birth if you have a home birth. And then what will happen is, in the case of an emergency, you will go to a state hospital where the gynecologist on duty will assist you if need be. I just have to point out that I'm explaining this to you in the context of the South African medical system, and I do realize that this differs from country to country, but I'm just giving you a broad overview of the different options. So just to recap, in terms of your primary healthcare provider, you can have a gynecologist at a hospital with a hospital-appointed midwife as a secondary healthcare provider. She will be there during birth with the gynecologist overseeing. I'm talking about a natural birth. Obviously, with a C-section at a hospital, it's a gynecologist. Then another option is a private midwife. You can have a private midwife as your primary healthcare provider at home with a gynecologist backup in a private hospital, which has to be arranged and agreed to. Or if you don't fall under medical aid, with a state hospital backup where a gynecologist that's on duty will assist you if there's an emergency. So that's the option of a private midwife at home. You also have the option of a private midwife as your primary healthcare provider in the hospital if you give birth naturally, with again the backup of a gynecologist who has agreed to be that midwife's backup. This isn't possible in all hospitals, so it's something that you will have to check. Lastly, there's also the situation where you might have a hospital-appointed midwife as your primary healthcare provider with gynecologist backup if need be, whether it is at a hospital, a private hospital, an active a birthing unit, or it can be a state hospital. We will talk more about the different aspects in birth and the many choices that can be made in birth at a later stage. But for now, it's just important for you to know that what the different aspects of birth are, like explained, so that you can know what to ask and how to decide what is important to you when it comes to your birth, and what to look at when you actually develop your plan A, B, and C. Once you know what is important to you in terms of birth, you can loosely develop a birth plan or a birth preference outline in consultation with your birth team. And it's a good idea to have a plan A, B, and C so that you can actually achieve as many of your objectives in birth as possible. But you also need to have the understanding that the idea is to achieve as many as possible, and that in some instances you'll have to let go of some of them. That gets back to the positive versus perfect birth, which we will discuss later. In the next and last video to this mini-series, I'm going to explain to you how striving for a perfect birth in an imperfect world sets you up for disappointment, frustration, and a feeling of rejection. I will show you how a positive, optimized birth and an enjoyment of the journey that is parenthood should be your ultimate goal when it comes to birth. I'm going to talk to you about the stigmas, the bashing of choices, and the pressures that exist in the modern day birth. How you can love your birth and embrace the beauty of parenthood, no matter the little imperfections. The perfect birth does not exist, and in the last and final video of this series, I will explain to you how you can rather work towards a positive and optimized birth experience. Before we go today, I would love to hear more from you. So please use the comment box below and tell me about the clinical and the emotional aspects of your birth that's important to you. Talk to me about the different decisions that you are making, and please feel free to ask any questions. I will read through absolutely every comment and answer as many questions as possible. Just remember that I'm not a medical or a clinical expert, and where need be, I will refer you to the correct person for your question. And please, if you found this video helpful, help me to empower more parents by sharing it. You can share the URL on Facebook, Twitter, or via email. And if you haven't registered for all 3 videos from At the Heart of Birth introductory course yet, you can do so now at the link below. If you haven't watched the other videos, you can go to video 1 now. Video 3 will soon be available.